The Center for Population Health Management and Quality at UTHealth Houston strives to deliver cost-effective, high-quality care for our patients. The center focuses on 6 key areas: innovative systems change, interdisciplinary collaboration, harnessing data into actionable insights, creating learning and quality improvement networks for the next generation, and improving outcomes across the entire lifespan. We believe in partnering widely, working hard, and then also making sure that these changes are sustainable over time.
Initially, our intention was to not only build a center for population health to improve the population's health, but it was also actually make a visible difference in the population's health in our community, rather than simply have an academic center that does research and evaluation.
I wanted to create the Center for Population Health Management and Quality to bridge the vast silos of knowledge that we have here in Houston. Houston really is a tale of two cities. We have the world's largest medical center, and yet Houston also has high uninsurance rates.
Interdisciplinary collaboration is critical with regards to our success. We are a team-based approach to care. We use everything from our physician providers to advanced care providers, to nurse case managers for chronic disease management, to community health workers in the clinics, to social workers, to behavioral health therapists, clinical dietitians, educators, financial counselors. We basically are able to deal with the entire gamut of issues that patients have that are not simply medical issues, but other life issues that affect their ability to achieve the fullest health that's possible.
I'm a primary care provider, and I spend much of my time doing chronic disease management. The team-based care allows me to provide much more educational support to my patients, and I'll use an example. If I have a patient with poorly controlled diabetes, there's no way that I can explain everything about the diagnosis and the management in a 15-minute office visit. What I can do is establish the initial treatment plan. Then the diabetic educator can teach about how to use a glucometer or what is a diabetic diet. My community health worker can help that patient get to and from visits. And the clinical pharmacist can help me adjust medication doses quickly in between visits.
Our UTHealth breast cancer screening initiative was started to improve breast cancer screening for our patients. It's a twofold project where we have a system level intervention and then an individual outreach side of the project. And in our system level, we have reminders sent to patients to let them know that they are due for a breast cancer screening. And then in our one-on-one approach, we have our community health educators who call patients and let them know. The benefit of this is system level, we get to reach out to a lot of people at once. And then with the individual approach, if that nudge didn't get them to get screened, we can give them a phone call and really see, what was keeping them from getting screened. Do they have questions about insurance? Do they have questions about where to go? And that one-on-one support, some people really need that, and we're able to offer that to them.
A typical day as a community health education specialist involves coordinating wellness programs, checking referrals, and connecting patients with our programs and health information that we offer. I also collaborate with our care teams to connect patients to the support that they need and also necessary health information so that they can effectively manage their health.
As a community health education specialist, I'm able to apply some of the things that we practice to system level projects. So things like understanding behavior change, understanding readiness to change, and tailoring health messaging has been really important in the work that the center does. I've been able to work on projects around outgoing patient communications to ensure that they are appropriate and relevant. Our work with communities really assists us in being able to best manage and leverage stakeholders, whether it be from various levels within the clinics or with community-based organizations.
As a health economist, I can help support population health management and direct the right care to the right patient by applying data analysis, economic models, economic theories, to translate complex data into actionable insights to support decision-making and resource allocation.
The Center for Population Health Management and Quality at UTHealth Houston really serves as a bridge to connect vast areas of knowledge. We really want to connect research and evidence and make it part of everyday care. We think that every American, every Texan deserves the best care that they can receive. And that's our focus, that's our mission.
Thanks for watching, but now an important disclaimer. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Viewers should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.